Then we go into our acne category. So our acne category, like I said, I would put this up against anybody right now. It is absolutely phenomenal. We're using so much technology here. We're not just saying salicylic acid and that's kind of it. We're really looking at a multitude of different ingredients to fight acne. So remember, when we look at acne, there's 4 pillars of acne, right? We're dealing with retention hyperkeratosis, basically a fancy way of saying their skin cells don't want to let go. We're dealing with thicker, stickier oil or sebum because of hormonal imbalance within the skin. Then we're dealing with impactions, not allowing oxygen into the follicle and creating bacteria growth, so we have that bacteria. And then we have inflammation. So there's all 4 things here. And typically what brands do is they're like, here's salicylic acid. And it's like, okay, it exfoliates, but what about everything else, right? So back in the day when I was working actively in the treatment room, I always treated the inflammation first. Once I knocked that down, it was a lot easier for me. Because when you look at somebody with acne, what are we looking at? Inflammation. Like, that's the hardest thing to look at. If I took all the red away, it'd be like, oh, it's not that bad, right? So that's what we really focus on here. Between the Derm Shield, taking down that inflammation, it allows us to up the exfoliation, but then we also use a lot of beautiful anti-inflammatory agents and other ingredients that are going to help fight all 4 pillars of acne. So number 1, we have our AcNo Solution. I love this product, not just for my full-blown acne patients, but for my patients, and we all have them. They come in, they're like, I have acne, and she has like 1 zit. And I'm like, I will play along with you for sure. But she like picks up the acne kit. I'm like, put that down. That's gonna wreck your life because it's gonna rip your face off. I get you have 1 zit and it's ruining your week. I understand. I feel you. Show her AcNo Solution, okay? It's great. It has a 2% salicylic acid in it. Has a 4% niacinamide. Niacinamide is great at regulating oil production. It's an anti-inflammatory. It's also going to have an ingredient in here, this one right here, perfluorocarbon emulsion. Perfluorocarbon emulsion, bit of a mouthful, but it's a really awesome alternative to benzoyl peroxide. So benzoyl peroxide, kind of an old school ingredient, very effective, but we know benzoyl peroxide has a couple of side effects. Number 1, super drying. Number 2, when we work on deeper skin tones, it can cause hyperpigmentation. So it's not form-fitting for everybody. So perfluorocarbon emulsion has the same action as benzoyl peroxide, but no side effects. So what perfluorocarbon emulsion does is it introduces stabilized oxygen into the impacted follicle to help kill that bacteria. And that's essentially what BPO does, per oxide for oxygen. It does that, but it has that drying ability to it. So I love the AcNo Solution. It's going to be based in an oat extract base. So again, working on taking down that inflammation. It's a gel base too, so it's very lightweight. So I would put that in a full-blown acne regimen, but I would also just recommend that by itself for my situational acne patients. I call them my pretend acne patients. I'm like, girl, I'll play along. I'll give you your 1 little acne product to like pacify you, but you don't need all the things, all right? Because remember, if somebody doesn't have acne and then they go on a full-blown acne regimen, what do you think I'm gonna do? I'm gonna give them acne, right? They're gonna have some sort of reaction, so. All right, then we have our AcNo Complex. So this is our ampule for acne. So this particular one, you're gonna have more sodium PCA than sodium hyaluronate in there. So it's gonna be very, very watery, very, very lightweight. They're gonna be very comfortable in it. What I love about this one is it has a 6% niacinamide. So we really up the percentage of niacinamide in there. And then we have this ingredient here, the Dipotassium Glycyrrhizate. Sounds like a Snoop Dogg lyric. That's licorice root, all right? That's all you need to focus on. It is a licorice root extract that has powerful anti-inflammatory properties. It is beautiful for an acne patient. So the AcNo Complex, I love it. I also love the AcNo Complex for perioral dermatitis. And I know we saw a lot of that when the masks were getting worn. People were getting a lot of PD, myself included. So what I love about this is the niacinamide and that licorice root extract being in such a lightweight base. It's a wonderful treatment for perioral dermatitis as well. Yes?
For the AcNo Solution, for non-acne patients, do you still do it self-treated?
They can put it all over because there's no exfoliants in here. So even if like I had my pretend acne patient come in and she wants to use this, that's fine. Or like even me when I have my perioral dermatitis, I put it all over. It's not gonna hurt me. There's no exfoliants in there. It's just gonna be really nice. I'll point out the ones with spot treating in a minute. Great question though. All right, so that's your AcNo Complex, super, super lightweight. It's also great for rosacea as well. Then we have our brightening category. We have our double white. All right, so we put this near the acne category because what always happens after acne? What's left over? Scarring, right? So it's very common that we treat acne, but that we also treat hyperpigmentation pretty much synergistically together, right? So here in our double white, you're gonna find this beautiful package that has 2 chambers with individual pumps of one another. So it's not one pump with both the chambers. Chamber A goes on first, and chamber A is going to have your Vit C11S serum. I already talked about that, so I'm not gonna go over it again, but that goes on the skin first. That vitamin C is gonna help break up the hyperpigmentation, be a tyrosinase inhibitor. Those are all the things that we want a vitamin C to do. Chamber B is gonna be our Tran-X-AZ solution or cream. So basically, hydroquinone was kind of the original brightening solution for the skin, but it is illegal in every country except for the United States. We ding-dongs down below, we're like, oh, it's fine, it's totally fine. But it's like, no, it's a known carcinogen. Like long-term use of HQ causes cancer. But the problem is with HQ, rebounding happens. I see it all the time. Patients go on hydroquinone from their doctor. Their doctor goes, you get it for 3 months, and then you go off. The minute they go off, guess what comes right back? And I'm like, cool, we're just gonna keep doing this. So what's so amazing is finally FDA in America is kind of stepping in and being like, all right, we got to be done with this. So they're making it a little trickier for HQ to come around. So basically, because we are an international brand, we've never used hydroquinone. But we're always on the lookout for ingredients that are going to be really competitive to HQ. And that's what tranexamic acid is. So tranexamic acid is a beautiful tyrosinase inhibitor. It brightens the skin and it's safe for long-term use with no rebounding. Like, I don't get why anybody isn't like slathering this all over themselves at all times, right? So what we did is we put a 5% tranexamic acid plus a 5% alpha-arbutin. Alpha-arbutin is a botanical brightener, so those two are working together there. But then we also remember when treating hyperpigmentation, we have to slough off the pigmented cells. So that's why we're gonna do azelaic acid and an azelaic acid derivative. So combined, you're having like a 23% azelaic acid exfoliation technique there. Great anti-inflammatory exfoliation, really good at breaking up existing hyperpigmentation. So what you're gonna do is you put chamber A on first and then finish up with chamber B. So my recommendation is if somebody is acneic, I tend to treat the acne first. Once I get the acne under control, then I can start eliminating certain things. So I might say, okay, like the acne's under control, we could probably take away the AcNo Solution, or I can take away the intensive hydrogel. And now we're focusing on, oops, I hit the wrong button. Now we're focusing on the post-inflammatory hyperpigmentation. I'm gonna move you here. So this can go on over the AcNo Complex or things like that. If they wanted to spot treat, they could just spot treat with chamber B. And they could still use the intensive hydrogel if they wanted to, yes.
Now, is this the acne products, is it good for pre-adolescent skin?
Yes, I do recommend, so the question is, youth, pre-adolescent skin. Just from where I stand in the States, I always say anybody under the age of 16, check with their doctor.
Right.
It should be fine, but again, we don't test on children.
No.
So anyone under the age of 16, just double check with their pee. Okay?